Hi, my name is Jen, and welcome to the WIC breastfeeding class. In this class, we'll talk about why choose to breastfeed, some of the health benefits for you and your baby of breastfeeding and breast milk, how your breasts actually make milk, your baby's first hour after they're born, how to get your baby to latch onto your breast, how often to feed, and some of the common problems and questions that some new moms will have. So the first slide, why choose to breastfeed? And I want to start out by saying how you feed your baby is your choice. So this class or WIC is not here to convince you necessarily to breastfeed. We are just here to give you more information so that you have everything you need to make a choice that is right for you and your baby. Breast milk is encouraged as the best food for your baby by health experts. And some of the reasons are because it is made by you specifically for your baby. And there are unique health benefits that come with breastfeeding and breast milk for you and your baby that we'll get into a little bit later on. Formula is a safe alternative when breastfeeding isn't possible or if it isn't what you choose to do. It doesn't have all of the special qualities of breast milk, but it is still safe and your baby will still grow and be healthy. One thing to note, if you're not sure whether you want to breastfeed or formula feed, even just a small amount of breast milk will boost your baby's immune system, even if you want to try it at the beginning. The American Academy of Pediatrics recommends to feed your baby only breast milk for the first 6 months of their life. After that, they recommend introducing foods around 6 months when your baby is developmentally ready. And then after that, continue to breastfeed and let them try foods and begin to eat more as long as you and your baby would like to. You can even breastfeed up to 2 years and longer. There are many medical experts agree that there's still lots of benefits even for this long of a time. But again, even a short amount of time will benefit both you and your baby. So some of the breastfeeding benefits for you as a mom, it lowers your risks of disease and serious health conditions like postpartum depression and anxiety, breast cancer, ovarian cancer, and type 2 diabetes. It can also help you recover quicker after delivering your baby by helping shrink your uterus back down to a normal size. You'll always have food with you for your baby, even in an emergency. It will save time. You don't need to prepare formula or wash bottles every day. And it can save you money because formula is quite expensive. Some of the breast milk benefits for your baby are that it has antibodies to protect against viruses, parasites, infections, and diseases. And it not only protects them during the time you're breastfeeding, but it will also help protect them for the rest of their life. There are proteins in your breast milk that can reduce the risk of your baby developing certain cancers, white blood cells that help fight infection, enzymes that help your baby digest and that will boost their immune system, stem cells that may help their organs develop and repair, hormones that help them regulate their appetite, so hungry and full, probiotics and prebiotics to support a healthy digestive system, the vitamins and minerals from the foods you eat or have stored in your body or in your breast milk. So all of those are going to benefit and go to your baby as well. And then there are these long chain fatty acids in your breast milk that help your baby's brain, nervous system, and eyes develop. Just like your body makes all of the nutrients your baby needs to grow during pregnancy, your breast can make enough milk for your baby after they're born. So what I want to show you is kind of how your breasts start to make milk or how that happens. So this first cluster here, they're called alveoli. So these are grape-like clusters of cells inside of your breast that make milk in response to your baby's sucking. So that is where the milk is actually made in these little cells. and your baby sucking on your nipple, it signals to your body and it sends hormones that tell those cells to produce milk. After that, the milk travels down milk ducts, these thin tubes that carry your breast milk from those alveoli clusters down to your nipple for your baby. Your areola is the dark area of skin around your nipple that produces natural oils to keep your nipple clean, and your baby can actually smell those oils and help them find your breast to breastfeed. And then your nipple is right in the center of your areola. It has a lot of small openings that spray milk into your baby's mouth, kind of like a shower head, rather than one steady, nice stream of milk. It's more of a spray at the end of your nipple. When your baby is first born, their tummy isn't very big. So on the first day, it's about the size of a cherry, so really small, which means they don't need a lot of breast milk to fill them up. About 1 to 1.5 teaspoons is all they need in that first day or two. After that, their tummy will start to grow to about the size of a walnut by day 3, and they're drinking a little bit more milk each feeding. After that, at about 1 week, their tummy is going to be the size of an apricot, and again, drinking about 1.5 to 2 ounces by that point. And then at 1 month, their tummy is going to be the size of a large egg and drinking about 2.5 to 5 ounces each time they feed. So as your body begins to learn how to make milk and respond to your baby, it will make more milk over time, which is perfect because your baby's belly is going to grow over time as well to hold more milk. So as your body makes milk, there are actually different types of breast milk that it makes. So colostrum is the first type of breast milk that you make, and you actually start to make it during your pregnancy. So it is your baby's very first food. It is thick and yellow and a little bit sticky and gives them a lot of antibodies to help protect them from diseases, and it lines the inside of their intestine to, again, help protect them now that they're outside of your womb and in the world with a bunch of different germs that are new to them. Transitional milk is the next stage that you'll start to make over the next 2 weeks after you deliver. Some people call this when your milk is coming in, and you're going to notice changes in how your body feels. So your breasts are going to start to feel fuller. And if you see your breast milk, it's going to change from that thick yellow colostrum to a more thin and white breast milk, a little bit more probably what we think of when we think of breast milk. After that, your body makes mature milk. And this is the type of milk you'll make after your milk has come in, and the type of milk you'll make the rest of the time you decide to breastfeed. So there are actually 2 types of milk in mature milk. There is foremilk and hind milk. And both of these are made naturally by your body each time you breastfeed. Foremilk is the milk that comes out first in a feeding. It hydrates your baby, gives them nutrients and antibodies, and is a little bit of a bluish, thin color and look. After that, your body changes to making hind milk, which is where the fat and calories are and what helps your baby gain weight and helps them feel full. So there's not really a distinct line during a feeding where your body changes from making foremilk to hind milk. It gradually will change, but that second milk is really important so that your baby is gaining weight and feeling full, not just always drinking the very first milk that comes out of your breast. Vitamin D is an important nutrient that your breast milk has some of, but not enough naturally. So healthcare providers recommend almost all breastfed babies get a 400 international unit supplement of vitamin D every day. And the best way to do this with infants is just a dropper. So you'll see in that picture a little syringe, and just giving 1 drop a day is going to give them enough vitamin D to help them grow and help their bones be healthy. There are different options, and if you're not sure which one to get or want to make sure that it has enough vitamin D in the supplement, you can talk to your doctor or WIC breastfeeding expert, and they can help you know which one is going to be good for you and your baby. So in that first hour after your baby is born, you are going to want to do skin-to-skin contact. So that all that means is putting your baby on your bare chest right after they're born. There are lots of benefits for both you and your baby. We'll start off with your baby. That skin-to-skin contact helps them get used to life outside of your womb. So there's lots of changes, everything's new, and having that skin-to-skin contact can help comfort them. They can hear and feel your heartbeat. They can hear your voice, and they'll recognize that because of pregnancy. And then they can breastfeed better, and that skin-to-skin naturally is going to help their heart rate, temperature, breathing, and blood sugar adjust into normal ranges. So there's lots of really good benefits of just placing your baby skin-to-skin after you're born. Some of the benefits for you is doing skin-to-skin in that first hour gives you time to bond with your baby. So this can happen whether you have a natural birth, a vaginal birth, or a C-section. You can still have that skin-to-skin contact right after to help you bond with your baby. It can help your body heal. There are hormones that are released just through that skin-to-skin contact that will help lower your risk of postpartum depression and anxiety. And it actually starts to signal to your body that it's time to make more milk. So you're going to start to make milk during pregnancy, but that contact with your baby is going to signal that now it's time to actually make milk for them now that they're here. Skin-to-skin contact is great in that first hour and during the time you're at the hospital, but you can also do it at home. It's great for dads or partners or anyone else that wants to have that special time with the baby too. So again, in that first hour, your baby is going to start to eat, and they will smell your nipple and breast milk and naturally want to move their way towards it. So if you have them skin to skin on your chest, they're nice and close. They will look for your breast and nipple. So with your areola being darker, your baby can really just see contrast colors when they're first born. So that helps them recognize and see what they're going to. Their head will move up and down as they make their way over. And if they're having a hard time, you can even do skin to skin, put their cheek on top of your breast to help them just be right there by the milk. And then again, remember their tummy is really small at the beginning, so they only need about 1 teaspoon of colostrum, that first yellow, thick, sticky milk, each time they eat. So you can see that in that cup, that's about 1 teaspoon. That's kind of what it looks like when they're first eating. One thing to remember also in the first hour and through the whole process is to be patient. Your baby is learning a lot of new things, and so are you. So as you start to practice and start to breastfeed, just remember that it's all about learning, and it's okay if it takes a little bit of time. So these are some signs that will tell you if your baby is latched onto your breast correctly. The first one is you want to start out by pointing your baby's nose, shoulders, and hips towards you and your breast and nipple so that your baby doesn't have to turn their head to one side or the other to feed. Once you have them squared towards you, you can touch your baby's nose and their upper lip with your nipple. Wait for them to open their mouth. That'll be a reflex that they have, is to open once they feel that contact and smell. Wait until they open their mouth really wide, and then you'll quickly bring your baby onto your nipple and breast when their mouth is open. You'll point it back towards the roof of their mouth just so they get a good latch. If you feel any pain at this point, that is a sign that it might be best to try again. So an easy way to break the suction of your baby on your breast without harming you or your baby is just to slide your finger. So your pinky is a great option, or your index finger, right into the corner of your baby's mouth to break that suction naturally, and then you can try again at step 1. So we're going to watch a little video that shows how to latch your baby.
Are you ready to make feeding time with your baby easier and more enjoyable? A great latch is key to good milk flow and a relaxed experience for both of you. Let's walk through some steps to help you get there. First, get comfortable. Find a cozy spot and use pillows for support. Behind your back, under your baby, wherever you need it. And don't forget to have a drink and snack nearby because breastfeeding can make you thirsty and hungry. When it comes to supporting your baby, place your thumb and index finger gently behind their ears. Let your hand and support their neck and back. Make sure their chin is tilted up, their tummy is facing you, and their ear, shoulder, and hip are in a straight line. Place your baby's nose so it's lined up with your nipple. Lightly touch their nose with your nipple to help them open their mouth wide. When your baby opens wide, bring them to you instead of leaning toward them. Here's a handy trick. Think of latching from the bottom up. When your baby's nose is lined up with your nipple, they'll reach up and over to latch, which helps their bottom lip catch and flip out. To know if your baby is latched well, check their lips. They should be flipped out, their chin should be touching your skin, and their cheeks rounded. You should see long, deep sucking motions, and then hear swallowing followed by a little breath. It's their natural pattern to make sure everything flows smoothly. When your baby is finished, check your nipple. It should be stretched but still rounded, not flat or pinched. If it looks flattened or you feel discomfort, adjust your baby's position or latch next time. A little tugging is normal, but sharp pain isn't. If you feel pain, gently break the suction by sliding a finger into the corner of your baby's mouth. You can also try the sandwich technique. Shape the tissue from one corner of your baby's mouth to the other. This helps your baby latch deeper and more comfortably. And here's a handy tip. Press a little on your thumb just before they latch to tip your nipple up toward the roof and back of their mouth. Release the pressure once they're latched to avoid blocking milk flow. With a little patience and practice, you and your baby will get the hang of it. And remember, if you're having trouble or still feeling pain, WIC is here to help. You're doing great, and you're not alone. Keep up the good work, and happy feeding.
Okay. So, some of the signs of a good latch, just a reiteration of that great video, is you will hear or see your baby swallowing. Their chest and belly are going to point towards you so their head isn't turned. Their chin touches your breast. Their lips are turned and flared out with the tongue cupping under your breast and their ears moving slightly just as they suck and swallow. And again, the best sign of a good latch is that it's comfortable and pain-free for you. I mentioned a little bit in the video of setting yourself up to breastfeed. So you want to make sure your baby is latched on and comfortable. You also want to make sure you're comfortable as well so that you can relax and enjoy that time with your baby. So set up an area with everything you need. This might be water, snacks, your phone, a TV remote, anything you might need during a feeding session, have nearby. Make yourself comfortable with pillows or blankets or other things to support you. And try different positions to find what works best for both you and your baby. When you finish feeding on one side, move to the other side if your baby still is showing you that it's still hungry. One tip to help make sure that you are feeding evenly on both sides is to use a hair tie or a bracelet on your wrist. So whatever side you have the hair tie or bracelet on is the side you want to breastfeed. So if you start on the right side, you'll feed there. You're going to feed on the left, and then you're going to keep your bracelet on the right since you emptied all of your right breast and your left. If you only feed on your right side, you'll put your bracelet on your left breast. That way you'll know to start on the left side the next time. That way you're just going to keep it even. And then again, make sure you have your baby's ears, shoulders, and hips in line and facing you and your breast. These are different positions that you can breastfeed in. So we'll go through a few of these. And again, I just encourage you to try different ones. We'll kind of talk about what's each one is recommended for, but there's really no right or wrong. It's whatever works best for you and your baby. So this first one, the laid back or reclined position, is typically one that's recommended for new babies when they first start to breastfeed. So think of laying back in a hospital bed or on your couch or in your bed with some pillows underneath you, and then placing your baby, that skin to skin, right on your chest, and they're going to move around, and their belly is going to be touching your belly, and their head is going to be facing you. The cradle hold is another one that works best for full-term babies with good head and neck control. And it may feel a little bit more comfortable for you and your baby once they're a little bit older. So your baby's head is going to be in this crook of your elbow on the same side that your baby is feeding from. So if they're feeding from your right breast, the baby is going to be in your right elbow. You're going to support them with that right forearm and your hand. Then your left hand can either support your breast or it can slide under and support your baby's bum or their back too. The cross cradle hold is basically just the opposite. So you're still supporting your baby with the forearm, but instead of your elbow supporting their head, it's going to be your hand supporting the back of their neck. So if you're feeding your baby on the right breast, you're going to hold your baby with your left hand and left forearm. And then that way you're going to use your hand to kind of bring your baby up to you. This one can work really good for small babies or babies who have trouble latching on, just because you have a little bit more flexibility using your hand to help control their head or neck, just the positioning. Like I mentioned in the video, you don't ever want to put your hand directly behind their head. There is a natural reflex that babies are born with that they will push back against your head or your hand, and that is not going to help them latch. So you're just supporting them at the base of their head, top of their neck, just to help control and give them some extra support. And then again, like you can see in the picture, she's using her other hand to help support her breast and position it while holding her baby. The clutch or football hold is one a lot of women do in the hospital as well. And it can be really good for women with larger breasts if you've had a C-section and are trying to protect the incision, or if you're feeding two babies at one time. So in this hold, your baby is going to come along the side of your ribs and then come all the way up. Again, you're going to support their head and their neck with your hand and your forearm, and then make sure they're still pointed towards you. This one works better typically when they're little. If they are bigger and you try this one, they might, if they're stronger, be able to kick against whatever's behind you. So just kind of be aware of that when you're trying it, that there's enough room behind you for your baby's legs. The side lying position is a great one for if you are breastfeeding in bed or you have an active baby that, again, you want to protect an incision from your C-section. So if it's during the night, it is a great way to pull your baby from the bassinet nearby. You can stay on your side and pull your baby up to you. So the bed is going to support them. Your hand is behind them to help draw them near you. And then your other hand, you can use your bicep as a pillow under your head. You can use a pillow, anything to kind of help prop you up or support you. But this can be a little bit more of a restful hold. Hand expressing is one way of getting your breast milk out without your baby actively latched on. So these are some of the ways or some of the times you may need to hand express. So if it's hard for your baby to latch on, your breasts are too full for your baby to latch, or if you don't have a breast pump, or maybe just for you it's easier to hand express than use a breast pump. Hand expression can especially be helpful those first few days after having your baby, so that you can give your baby colostrum if they are having a hard time latching, or maybe they have medical issues and they're not with you all the time. So in this photo, you can see that she's hand expressing into a small cup. And that is because, like we talked about, it's sticky, thicker. We want to save all of that colostrum. So a spoon or a small cup is going to help transfer it more into the baby than if you hand expressed it into a really big bottle or a big cup. And we will watch a quick video here showing a little bit more about hand expression.
So before you start expressing, it's a good idea to stimulate the hormones that get the milk flowing. So you can do this by massaging first, so massage gently all the way around the breast, and remember your breast tissue goes right up into your armpit and all around, so spend a few minutes massaging. And nipple stimulation, gentle nipple stimulation, also helps to stimulate your hormones too. Then to get the milk to flow from the breast, it's important to compress and release. So what we do is, it's quite a good idea if you think about when you pick up a cup like this, your hand goes into a C shape. So I've got my cup here, and then I'm just going to take my hand away and see I've kept that C shape there, and I'm going to put the C shape over my breast with the nipple in the middle. So I'm going to compress and release and compress and release, and it might take a few minutes for the milk to start showing, especially in the early days when you've just had your baby. In the first few days of life, you'll have smaller amounts of colostrum. So keep going like this, and then the milk will start flowing or start appearing, and you can be collecting the milk in a cup or in a syringe or in a small bottle. When the milk stops flowing, you need to move your fingers round and start compressing and releasing the next segment. And we like to think about the breast like an orange, and you're going to juice each segment of the orange. So keep going like this until the milk stops flowing, and then move round again. And while you are compressing and releasing, you're also pushing back into the rib cage a little bit, and that helps with the milk flow too. So express all the sections of the breast, and when the milk stops flowing on that breast, you can move over to the other breast and do the same on this side.
Okay. So one of the next questions a lot of women have is, how often should I feed my baby? And the first thing is that there's not really a set schedule. The best thing is to feed your baby when they're hungry instead of watching the clock. That is a hard concept for a lot at first, especially as you're getting to know your baby's hunger cues and what it looks like when they're hungry, what it looks like when they're full. So some time frames to give you is that newborns should only have one time each day where they sleep longer than 4 hours. So if your baby is sleeping longer than 4 hours multiple times, or they're having a stretch longer than 4 hours, then it's a great idea to talk with your doctor and maybe figure out ways that you can help wake them up sooner, or keep them a little bit more alert. And then when your baby feeds, they will probably eat for about 15 to 20 minutes at each breast. That is different for every baby. So some babies will just maybe eat on one breast, some will eat on both. You might have a quicker letdown, so your milk might come out faster, which means it takes your baby less time to eat. So those are all just things to think about And you don't have to, again, watch the clock to make sure it's exactly 15 to 20 minutes each time they feed. These are just some visual information cues. So your baby should feed about every 1.5 to 3 hours and 8 to 12 times each day. And if you follow those rules that they don't have more than one time a day where they're sleeping longer than 4 hours and they're eating for about 15 to 20 minutes at each breast, each feeding, you're going to stay in that range of feeding about every 1.5 to 3 hours and 8 to 12 times each day. So some of the early signs your baby is hungry is they might whimper or start to make little noises. They might smack their lips together, open their mouth, make sucking motions with their mouth, or they might start to suck on their hand. They might pull their arms or legs towards their tummy like a tight little ball. They might wake up and look really alert or move their hands or fists to their mouth. They also, if they're close to you, they might rub their face on your breast. All these are those early signs of hunger. And this is what you want to watch for to know when to start breastfeeding your baby. A late sign of hunger is that your baby is crying. So you want to watch for these early signs and hopefully start to breastfeed before you start to see late signs like crying. And then after you're feeding or while you're feeding, some of the signs you can watch for that show your baby is full is if they let go of your breast and nipple on their own or turn away from your breast, if they fall asleep and stop sucking, or if they relax their hands and their body. Those are all really good signs that your baby is full and that they've had enough. Normal dirty diapers for breastfed babies is another way that you can tell if your baby is getting enough to eat. They should be loose, no shape really to them. And one thing to look for is that they change color over the first several days. So you can see day 1 is going to be kind of a black, thick, like sticky tar-like poop. And then days 3 to 4, it's going to start to look more green, turned a little bit more yellow. And then around day 5, 6, you're going to start to see a normal poop for a breastfed baby. So mustard yellow, maybe it looks like it has seeds in it. That's actually what you are going for. That's a really good sign that your baby is getting enough to eat. So when it looks like, dark on day 1, green on days 3 to 4, that isn't a sign that your baby's not getting enough to eat. Those are just natural stages as your body is working things out of their system. So as long as they're having those poops, that's a good sign that they're having enough to eat. It's only after day 5 that you want to look for that mustard yellow seedy poop. And then one thing to know, if you've had a baby before or have been around friends or family's babies, if they've been formula fed, it's probably common that their poop is going to look really different from a breastfed baby's poop. So just know that there are differences in what to look for depending on what your baby is eating. Another thing to look for is that they're having enough dirty diapers. So this chart is in the breastfeeding guide, and at the end of this presentation, I'll show you where you can go to get that. But this is just showing days 1 through 6. So at the beginning, they're going to have maybe about 1 to 2 dirty diapers a day. Again, it's going to be black or black and green. Days 3 and 4, they might have about 3, 4 dirty diapers a day, and it's going to be start to change colors towards that yellow color. And then days 5 and 6, 4 or more, and then eventually each time they eat, they may poop. So those, again, it's just a good sign that your baby is getting enough to eat if they're having lots of dirty diapers. So those are poopy diapers. Normal color for their pee is yellow. In the first couple of days, you might see a little bit of a pink color in there. That's super normal. If it's really dark or it lasts longer than those first 3 days, just talk to your doctor and let them know what you're seeing. So now some common questions that a lot of moms have about breastfeeding. Am I making enough milk? So that's really common. You want to make sure, because if your baby is feeding directly at your breast, you aren't seeing the full amount that's going into their belly. So it can be really scary, or you're not sure how much your body is making. Again, you don't want to follow a set schedule. You just want to breastfeed as often as your baby wants to eat. And that does two things. Your baby is showing you that they're hungry. So if you're responding to those cues, you're going to be more likely to make enough milk for them. And then each time your baby sucks on your nipple and you have that skin-to-skin contact, the hormones in your body are signaled to make more milk. So back to the beginning when we talked about the alveoli, those are controlled by hormones, and that stimulation from your nipple, the skin-to-skin contact with your baby, even hearing the sounds of your baby and having them close, all of those things signal to your body that it's time to make more breast milk. So the more you feed your baby, the more milk your body is going to make. Many babies eat more at certain times of the day, especially evenings. This is totally normal and doesn't mean you aren't making enough milk during the day. It's just something that is kind of natural for their rhythm and way of eating when they're first born. They will have several growth spurts during the first year of their life. And it's helpful to know when these typically happen, because they might all of a sudden start eating more. And it can be a little bit alarming that, oh, I'm not making enough milk that I used to. They just want more than what I can give them. Again, it comes back to your body making as much milk as you get signals for. So around 2 to 3 weeks old, 6 weeks old, 3 months, 6 months, and 9 months are typically when your baby has a growth spurt, either in height or weight, and they just need more energy to keep up with the growth in their body. So it's not that you're not producing enough milk, it's just that they need more during these times, and the more they feed, the more milk your body is going to make for them. There are some things that you can do to make more milk if you are worried. Responding to your baby's early hunger signs. So those early signs, rather than waiting for them to cry or be really fussy. Feed your baby from your breast as much as you can. Make sure your baby latches correctly. So a correct latch is going to make sure you're getting full stimulation on your nipple. You can massage your breast before or while you breastfeed or pump, which you saw in that hand expression video. It's a very similar technique. And skin-to-skin contact with your baby is a way to, again, release those feel-good hormones and help you relax. Anytime your body is relaxed, you're going to make more milk, which comes to the last one. It is so important to take care of you. You are not going to be able to feed your baby quite as much milk or have as an enjoyable time as you could if you aren't taking care of you first. So some of the things that you want to make sure you do is to eat a balanced diet, drink enough water, take a nap when your baby sleeps, and ask for help from friends, family, neighbors, anyone around you that is there to help you, so that you can rest and take care of yourself too. So on the other end of that spectrum, what do I do if my breasts get too full? So if you are feeling like pain or they're really hard, that's a sign that your breasts are too full. Something to do is to feed your baby at your breast each time they're hungry. So if you're away from your baby, maybe they are formula fed when you're away from them, your body is still going to make the milk. And if your baby isn't there to empty it, or you're not using the pump to take it out, you might get too much milk and start to feel some of those painful symptoms. So feeding your baby each time they're hungry is a good way to make sure you're not producing too much milk. Pacifiers, binkies, and bottles, especially in the first 3 to 4 weeks, while your body and your baby is adjusting to breastfeeding, is going to help you. So whenever your baby is showing those early signs of hunger, bring them to your breast rather than giving them a pacifier, a binky, or a bottle. That way you and your baby can figure out how much milk you actually need to make for them. You can take a short warm shower or put a warm wet towel over your nipples and breasts for 3 to 5 minutes before you feed your baby. This is going to help take care of some of the pain and discomfort you feel. You can hand express a little milk to make latching easier for your baby. If they're really hard and maybe a little bit shiny, you can express with your hands just to soften it and let your baby latch on easier. You can put a cold pack on your breasts for up to 20 minutes between feedings. You never want to place it directly on your skin, so you can use a really thin towel in between. And another one is to gently massage your breasts, and you want to move from your chest to your nipple while your baby eats. So you can do it on the top and bottom of your nipple, or you can do it on the sides. And again, your breast tissue starts all the way back at your armpit. So coming all the way back from there, moving towards your nipple, and massaging it is going to really help get all of the milk out so you don't get too much breast milk. If you do end up getting too much breast milk, you might feel engorged or have more serious problems. So engorgement is what happens when your breasts are too full. One or both breasts may feel hard, full, warm, painful, or you may even feel like you have a slight fever. It can be most common for you to feel engorged during those first 3 to 14 days after delivery, when your body starts to make mature milk. And again, it's really trying to figure out how much milk your body needs to make for your baby. So it might overproduce or make too much milk. And then as you continue to feed your baby, your body is going to respond and even it out. If you suddenly breastfeed less often, like if you go back to school or work and you haven't slowly cut down on the amount of times you're feeding your baby in a day, that drastic change from feeding them every 2 to 3 hours to maybe feeding them every 6 hours, that's going to cause a lot of milk to stay stored in your breasts, and you might feel some of these symptoms. And then if you are engorged and you leave it untreated, you can get a plugged milk duct or mastitis, which are a little bit more serious. They can cause infection. You might have kind of like flu symptoms. Your body might ache. You're going to feel that red soreness on your breasts, and you're going to feel like you have the flu. It's really good to talk to your doctor if you feel like you're getting close to either like mastitis or a plugged milk duct, so that they can help you get medicine right away so that it doesn't go on longer than it needs to. Another question is, can I breastfeed if I'm sick? So some medicines are safe to take while breastfeeding, others aren't. It's usually safe to breastfeed when you're sick unless you have a serious illness or unless you're taking certain medications. So on the right, there is this QR code and a phone number and a link to Mother to Baby. They are a program that you can call for free that has a group of doctors and nurses that can answer questions about what medicine is safe to take while breastfeeding. So that is all they focus on, breastfeeding and pregnancy. They are really knowledgeable and a great free resource if you aren't sure if it's safe to take a medication and still breastfeed. Some of the best ways to keep your baby healthy, if you're not taking medication or you know the medication's safe, but you're still sick and don't want to get your baby sick, is to wash your hands often, cover your nose and mouth when you cough or sneeze, and then wear a mask if you need to around your baby. So a lot of the same things you would practice just to help avoid getting other people safe. But again, your body is going to make those antibodies to protect you and fight the infection in your body. And when you breastfeed, you pass those on to your baby, so it can help protect your baby against whatever the illness or sickness is you have. When do I need a breast pump? So there are lots of reasons you might need a breast pump. Some of the more common ones are if you have to return back to school or work. You want to have breast milk to feed your baby if you're not there, whether you're going on vacation or out with friends or just on errands, and want to have someone else be able to feed your baby if you're not around. If you're trying to make more milk or increase your milk supply, a breast pump can help because, again, it's that stimulation that signals to your body to make more milk. And if you're separated from your baby because of an illness, either you or your baby has. Another reason is you want to give your baby breast milk, but you don't want to or can't feed from your breast. So there's lots of different reasons why that might be. If that just doesn't make you feel comfortable, or you aren't able to feed your baby directly at your breast, but you still want to give them all the great benefits of breast milk, a breast pump is a really great option to help you do that. And again, if you can, try to feed your baby directly at your breast as much as you can, even if you also pump, again, from that direct skin-to-skin contact is really good for you and your baby. So if you do need a breast pump, there are different ones to know about. So electric breast pumps are best if you need to pump a lot or need to increase your milk supply. If you are pumping because you're going back to school or work, you're away from your baby every day or 5 days a week for a few hours, you need to pump a couple times, an electric breast pump is great because you don't have to do any work. You can plug it in and it does the work for you, and then you can store your milk. A hand pump might be the best option if you'll only be away from your baby for a short period of time each day, or a short period of time once or twice a week, or if you only need to express the milk. So if you are getting engorged and just need to express some of your milk so that it softens your breast and your baby can feed better, a hand pump might be a good option for you. If you know that you'll need a breast pump, talk to your doctor or insurance company as early on in your pregnancy as you can. That way you're more likely to get it in time from when you deliver your baby. And just know that WIC may be able to provide a breast pump after your baby is born, depending on what your situation is. So you can always talk to a WIC nutritionist about your specific situation, and they can help you, but know that they can't give that breast pump to you until after your baby is born. Whereas if you work through your doctor or your insurance company, you're likely going to get a breast pump before your baby is born. If you're expressing your milk in any way, you'll need a way to store it. So this, again, is in the breastfeeding guide that I'll show you later. But some of the different ways to store your milk is if it's left out at room temperature. So on the countertop or a table, it stays good up to 4 hours. If it's freshly pumped or you just expressed it. If you thawed breast milk and it's out on the countertop or table, it's only good for about 1 to 2 hours. You can also store breast milk in the refrigerator. If it's at 40 degrees or below Fahrenheit, which is normal refrigerator temperature, your breast milk, if it's in a sealed container, will stay good up to 4 days or 96 hours. Again, if you thaw your breast milk and then put it in the refrigerator, it only stays good in the refrigerator up to 1 day or 24 hours. You can store it in a freezer and it stays good up to 6 months. And if you thaw breast milk, you never want to put it back in the freezer just because some bacteria can grow and you don't want to store that and have it continue to grow before feeding it to your baby. The other option is a deep freezer, so one that you aren't opening every day. And there it's going to be colder, it's not going to be opened as much, and your breast milk can stay good up to 12 months. Again, never refreeze thawed breast milk. So there's lots of different options of storing your breast milk depending on how long or how soon you'll need it or how much you have. Another question is, how do I breastfeed if I go back to work or school? There is a law in Utah that protects your right to pump and express breast milk at most workplaces. So your employer should let you pump when you need to for as long as you need to. The law doesn't say how many breaks they need to give you or how long each one is. That is something that you need to talk to them about. Most employers are required to allow you to pump, but they're not required to pay you for that time. And then another thing to know is just try to pump the same number of times you'd usually feed your baby. Again, that's not always possible because that's something you're going to have to work out with your manager in your workplace. But that will help keep your milk supply up if you're able to pump the same number of times as you usually feed your baby during that time you're away from them. An example would be to pump every 3 hours if you usually breastfeed every 3 hours. Some resources I want to make sure you're aware of is the Pregnant at Work initiative. It is a free helpline that you can call and talk to a lawyer about workplace issues or questions you have that might be related to pregnancy, breastfeeding, or caregiving responsibilities. So that's QR code that takes you to their website, and it gives you the phone number and it tells you more about that service. So again, that's a free one. And then there's another free helpline called A Better Balance that you can call to learn more about workplace rights to care for yourself and family members. So those are two really good free resources if you are having problems trying to find time to pump at work or having a hard time knowing how to talk to your boss about pumping at work or about that change in your life. These are really good resources that can help provide some answers to you. And then as we kind of wind down in this class, I just want to remind you that you can do anything, but you don't have to do everything, especially not alone. So it is really great to ask for help taking care of your baby. There are friends and family around you that do want to help. Some of the ways that they can help are doing skin-to-skin contact with your baby. They can go pick up groceries for you, make meals or snacks for you or for other kids. They can prep things so that you can grab and go easy. They can clean your house or do laundry for you, take care of your other children, give your baby a bath, or change your baby's diapers throughout the day. So those are just some ideas of ways when other people ask how they can help. Go ahead and give them a couple of these items. Some other ideas are to have them burp your baby. They can sing or read to your baby, comfort or soothe them. They can put them to sleep. And if you have all of this help, you're getting enough rest, you feel like you have a good support system, and you just still aren't feeling yourself, or even if or maybe you don't have a lot of support and it just feels really overwhelming, know that there are people that you can talk to that want to hear how you're doing and that can help give you support. So you can call, text, or chat 988 if you have thoughts of harming yourself or someone else, or if you just need someone to talk to about how you're feeling. And then the last thing I'll leave you with is that you can do this. Breastfeeding is a journey, and every parent and baby are unique. So some of the things to remember is to trust your body throughout the process, follow your baby's cues, and know that support is always here for you. So however you choose to feed your baby, as you're learning more about breastfeeding, as you're thinking more about what your responsibilities will be after you have your baby and how you're feeling, just know that that decision is yours and your decision matters. WIC is here to help you feel supported and confident, well-informed about making those choices, and supported no matter what you choose every step of the way. Some of the ways I just wanted to point out that your WIC clinic can support you. There are breastfeeding peer counselors, which are other women who have breastfed before. They are ready to help answer questions, give you support, listen to how you're doing. And on the WIC Shopper app, it's a free app that you can download to your phone. There is a list of resources for breastfeeding. So there's a whole tab. There's lots of information on there. But on this first tab, Breastfeeding Peer Counselor Contact, if you click on that button, it'll show you the number you can call or text for every WIC clinic in Utah. So find your clinic. That's the number you can call or text specifically for breastfeeding support. Another resource I want to point out on the WIC Shopper app is that there's a button to find a WIC office. So if you need a quick way to look up your office's contact information, you can find it on here. It's going to show you their address. Then you can click on it and it'll show you their contact information. If you need to schedule an appointment or get help that way, that's a great option too. And then last but not least, this is a QR code and the breastfeeding guide that all of this information throughout this class has come from. It goes more into depth, it answers a few more questions, and has all of those charts and pictures for you to look back at and to share with families and friends that maybe have more questions about breastfeeding. It's available in English and Spanish. So this is a QR code that takes you to our website. You can download the breastfeeding guide for free and use it to learn about breastfeeding before you have your baby, and then use it to refer back to and help answer your questions after, as well as WIC staff. So good luck with the rest of your pregnancy and your journey towards breastfeeding.